Currently, about 10 people who've been diagnosed with the Legionnaires in the Highbridge section of the Bronx.
Councilwoman ALTHEA Stevens represents much of the area that the City Health Department is investigating for Legionnaires, the zip codes of 10452 and 10456. Legionnaires is a bacteria that grows and spreads in cooling systems, namely water towers, which health officials are currently testing.
The water is still safe to drink. This is not any issue with any plumbing systems within any of the buildings or complexes, but this is us just taking extra precautions to make sure that this is not an extended outbreak.
Those precautions include putting up flyers in possibly impacted areas. That's a crucial step because
it can be tricky actually to differentiate COVID from Legionella, and the symptoms can be very, very similar.
Dr. NIMA MAJLESI at Northwell's Staten Island University Hospital says doctors can most easily tell the difference between COVID and Legionnaires with a chest x-ray. He says particularly if you have a cough and fever and test negative for COVID but are living in the sections of the Bronx under investigation, consult a medical professional, especially if you're older or immunocompromised.
Legionnaires is not a death sentence. It's very treatable. But I think the most important thing is if you have signs and symptoms, certainly get evaluated by a physician as soon as you can.
This is not unheard of either. The health department says between 200 and 500 cases are seen in the city each and every year. There are generally clusters that pop up when it turns warm because that's when those cooling systems ramp up and the bacteria starts to spread throughout various apartment buildings. Live in the Highbridge section of the Bronx, Henry ROSOFF, Pix 11 News.